let's move along and talk a little bit about engaging patients just a bit, because I mean, shared decision making is something that gets a lot of lip service, but actually in this disease is extremely important. So Patricia, why don't you say a little bit about that?
Shared decision making is very important. Knowledge is power. It's the patient's disease. They have to live with the treatment. So you really want to engage them. You want them to be a partner. You want to instruct them. You want them to understand realistic expectations from the therapy, how they need to follow up, what we would be looking for so that they buy into the treatment. Shared decision making does not mean you ask the patient, what do you want to go on? Shared decision making does not mean the doctor decides this is what you're going to go on. Shared decision making means we communicate, we elicit what's important to the patient, we tell them what we feel is in their best interest based on our acute assessment of their disease, their particular desires, and the drug properties, and we make a strong recommendation. But we're choosing as a partner, and I think that gets adherence, that gets buy-in from the patient.
Wallace?
Yeah, I think we have to work as partners with our patients, as Patricia said, and I think you can bet your bottom dollar that if you put a patient on a treatment that they do not want to be on, they're not going to take it.
Sam?
Yeah, if we want to have a relation over time to our patients, we have to go for a shared decision making, because if we decide something and this is not working, we will lose the patient maybe forever and we will not have a second chance. So I think if we explain our rationale and if we give a strong recommendation, and as mentioned before, if we convince the patients that the decision is in their best interest, then it's a shared decision. And if then something is not working, I think we have a quite good chance that the patient returns to us for a second guess and a second shot.
Yeah. So there's an important clinical skill involved in this, and that is reading what the patient wants from you. And we've seen criticism of both ends, with people saying, hey, the doctor didn't pay any attention to what I wanted to do with my body. To the other side, people say, I went to this physician for him to tell me what I needed to do for my disease, and he kept asking me what I wanted to do. So there is a certain skill in there to figuring out how to best meet the patient's needs and incorporate them into decision making.